Let's talk about vancomycin. So vancomycin is kind of an interesting one. It binds to a bacterial glycoprotein on the alanine surface of the peptidoglycan. So we've kind of magnified the peptidoglycan here. The resistant organisms to vancomycin have an altered terminal, so there's a decreased affinity for the vancomycin. In this case, the vancomycin is the yellow little star-shaped thing that you see there. We only use vancomycin for very serious infections. Now, vancomycin, despite the fact that we've magnified things and it looks like a small molecule, it's actually quite a large molecule, and it does not cross the blood-brain barrier. So if you have, say, a spinal infection or a brain infection, we administer it intrathecally. We use it orally, however, for luminal infections of the gut because it's not absorbed across the gut wall, so it stays inside the gut. And if you have an infection inside the gut, it's quite effective. The important toxicity that I want you to remember with vancomycin, and that I guarantee you'll be tested on, is something called red man syndrome. This somewhat sexist term applies equally to men and women, by the way. It causes severe cutaneous flushing from histamine release. So it's quite a dramatic and quite noticeable sort of reaction. And at first you think it's a type of horrible allergy. It's not quite an allergy in the same sense. It's actually a histamine release. It can also cause phlebitis, ototoxicity, and nephrotoxicity. So this is a potentially toxic agent. Let's talk a little bit about bacitracin. It's not often covered in antibiotic lectures because we tend to forget about it, but it's used tremendously in hospitals. It's used as a topical treatment and decontamination treatment for things like methicillin-resistant Staph aureus. So you'll often see patients being treated with bacitracin in hospital. It's used in Staphylococcus colonization of the skin. Now, it can cause nephrotoxicity, so it's not used orally or parenterally. We only use it topically for practical purposes. Daptomycin is a cyclic lipopeptide. It is for the treatment of vancomycin-resistant Enterococcus and vancomycin-resistant Staphylococcus aureus. You have to monitor creatinine levels very closely, CK levels very closely during treatment. And that's because daptomycin is very myopathic, and so it can cause severe muscle disease.